Hello everyone, today is June the 1st. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. I'm going to get to the numbers real quickly, but then I want to talk to something more important today. Across the state of Michigan, we're at 57,397 cases. That's an increase of 513 over the previous day, and 5,491 deaths in total statewide, an increase of 28 over the previous day's number. Here in Kent County, we're at 3,732 cases. We're seeing an average number of cases per day per million decline. Last week, we were at 57.9 new cases per day per million of population in our Grand Rapids region. We've seen that come down now to 30.6 new cases per day per million in our region. So that's a real great sign. Unfortunately, we're seeing our deaths continue to increase. We're at 88 deaths as of this morning. That's an increase of 3 over yesterday's number. And it's not surprising that the increase in deaths over the past couple of weeks has followed the peak that we saw in early May, late April. It's not unusual. We're seeing for a peak in deaths to follow by 3 or 4 weeks the peak in cases. We all have heavy hearts, to be honest, today, and a lot on our minds as we think about what happened over the weekend and what happened, what's been happening for a long time, but was again illuminated by the tragic death of George Floyd. What happened to him was evil, and what happened in Grand Rapids on Saturday night with violence and rioting was also evil. And we've always known that violence and racism are public health crises. They really are. They drive so many of the disparities that we see in health. Racism is a key problem in our community and the root of so many other problems. Disorder causes more disorder, and we saw a lot of that over the weekend. And so we all need to wrestle with that, and we all need to do everything that we can to address those problems. In public health right now, we're focused on this pandemic, and we're focused on it both because it's a problem for everyone, but we also know that it disproportionately affects people of color. We've seen that in the data so far, and there's lots of reasons for that. Racism is one of those many reasons, and the effects, the disparity in access to resources is a challenge. So, as I looked at the crowds rioting on Saturday night, I couldn't help but think about the invisible rioter in those crowds, and that's the coronavirus. That has no emotion, but if it did, it would be a very happy virus, because that is the perfect sort of environment for it to spread from person to person. And so I worry about more disorder. I worry about an increase in cases affecting those people and the communities that they're going home to and their families, and how that's going to perhaps further exacerbate the problems that we're seeing. So at the health department, we're going to continue to focus on beating this pandemic as a way of fighting disparity in our community. That would be a huge step forward. We're also going to focus on getting back to the other programs that we have done for a long time in public health that are all focused on health equity. They're all focused on making the world a better place for everyone and making our community better for everyone. So I want to encourage all of you, myself included, to look deeply inside and to confront, identify, look at any racism, any anger, any fear that you have inside of you. We need to confront it. We need to each do that individually and be honest with ourselves. If we can do that, that would be the most positive, the most heroic, the most healthy thing that we can do for ourselves and for our community. I'm Dr. Adam London, Director of the Kent County Health Department, and I'll talk to you again tomorrow. Thank you.